People That Deliver initiative is basically about finding more sustainable approaches to developing, recruiting, and retaining human resources for supply chains in developing countries. The members of the initiative have found that within developing countries, health systems typically use clinical personnel to manage the supply chains, and they typically don't have the required technical and managerial competencies to manage the supply chain efficiently. So we're looking for new approaches where we can work with countries in order to ensure that the people who are managing the supply chain have the right qualifications to improve access to medicines and health commodities. Yeah, so it started about 3 years ago as a work stream of a coalition of organizations focused on reproductive health supplies called the Reproductive Health Supplies Coalition. At that time it was just 5 or 6 agencies that were all concerned about this issue of kind of raising the profile of the supply chain workforce. But within that small group, we thought it was important to not work just within the reproductive health community, but to branch out and include organizations working in other programs, because the issue of the supply chain workforce, the lack of competencies, the lack of empowerment isn't specific to reproductive health, and we can have more success by working across programs. So we began a process of consulting with different organizations and engaging different organizations until we had over 60 organizations involved, and at that point felt like we had enough of a community to develop, to launch a conference and to really kind of bring this issue up at the global level. So that's when we created the name People That Deliver. That's the way to label this initiative, which now included a broad range of partners, and then held the Global Positioning and Harmonization Conference at WHO in June of 2011. So the global conference basically gave guidance to the initiative around the priority interventions that the initiative should take in order to move forward in this area, and also the kinds of structures that should be developed to support the coordinated activities of all the different partners involved, both at the global level and the country level. And so in the last 7 months since the conference, basically what we've been doing is establishing those structures. We started out by developing a draft terms of reference that basically set out the structures and procedures of the initiative. We sent that out to the membership, and that was approved by the membership. Based on that draft terms of reference, we then set up an initiative board, which is now the governance body, and which is meeting here at Bioforce today. So that was established in October, November. And this is now their 3rd meeting, so they're developing the policies that will kind of structure how the initiative works. And then in about December of 2011, we launched the 3 working groups for the initiative. And the working groups operate at the global level and are the ways that the different partners come together to work together, for example, developing competency frameworks for supply chain management, the kinds of competencies that are required in countries where the different partners would agree, developing, for example, guidelines on how ministries of health can better retain their supply chain workforce, which has been a significant challenge for countries. So those are up and operating, and then lastly, the countries themselves. We have 7 focus countries, and those focus countries, since the conference, have been developing their action plans to outline how that country sees themselves changing things, what activities they'll undertake to strengthen the human resources for supply chain management and improve the sustainability, identifying what partners would implement what activities, on what timeline. So basically, since the global conference, we've moved from, before the global conference, we were basically in a process of establishing a coalition. In the global conference, we kind of confirmed that coalition existed, that we had joint priorities, that we were willing to work together, and now we're moving forward into actually doing the work that should have impact in countries. In the process of really implementing the work to strengthen human resources for supply chain management, there's a whole variety of activities that are that are just getting underway. So the easiest way to break it down is by the working group. So in the technical working group, there's a series of guidelines, tools, resources that they're already beginning to develop that'll basically assist countries who want to take more sustainable approaches, giving them best practices to do that. There's a research working group which is establishing the evidence base for what would be the best practices, so doing research in country, doing research at the global level to document what the best approaches are. And then an advocacy and knowledge management group which has two objectives. The first one is still raising awareness about this issue, talking with both global level stakeholders and country level stakeholders around why it's important to change the way that we approach human resources for supply chain management to both increase sustainability and cost effectiveness, and then also increasing access to the resources that already exist, that are currently there's no place that a country or a technical partner can turn to easily access resources on what have been successful approaches in human resources for supply chain management. So the knowledge management aspects will facilitate access by working with existing web platforms, communities of practice, those kinds of resources. So the objectives, I would say, like in the short term, are at the global level, are to develop these tools that will be the foundation that the countries can use to move forward. And then, of course, in each of the countries, the partners will be putting their action plans into action.